So, hi, my name is Bryan Samp. I'm the Director of Patient Access at Texas Children's. In my scope at Texas Children's, I'm responsible for the pre-service activities. So basically the stuff that happens from the time in which a patient is scheduled until they arrive at the front desks. I have 21 of the front desks across the system. I have responsibility for our Med Center EC, as well as our Women's Assessment Center, which is our 24/7 shop. And then I have financial counseling on the inpatient side, which is responsible for notification to the payers when patients admit, helping facilitate Medicaid and charity applications. And then we have a dozen specialty financial counselors that are in some of our complex clinics, such as BMT or transplant, that work closely with the physicians and the families as they continue through their journey of care at Texas Children's.
Well, Brian, thank you so much for joining us today on the Access Point. We really appreciate you sharing your perspectives as we talk about improving the patient financial experience. As consumer perspectives continue to evolve, we see a real trend towards consumerism in healthcare where patients and families anticipate or even demand a different experience than what they may have had in the past. The industry is responding with new ways of engaging patients throughout their care journeys. And that, of course, includes the financial aspects of understanding their insurance coverage and any financial responsibilities that they have, including copays and increasingly high deductibles. At Texas Children's Hospital, how are you providing patient financial education to families? And what do you see as some of the challenges as well as recent improvements in this area?
Yeah, so I think we're trying to meet families in the ways in which they want to consume the information. One of our primary focuses is transparency, and so for all of our patients that are either looking to come to Texas Children's, making sure that we have an appropriate tool out there for them to understand the care of their health, their upcoming health journey, or to have some information that they can then absorb and make an informed decision. So in addition to what we've done through some of our website with our marketing teams, we also try to provide an estimate to every one of our families that's coming in the door, so they understand what that healthcare cost is going to look like. In each one of our, what we will think of like as a touch point, we try to ensure that we have that human element to it too. So there's so much that we can do through my chart and through posting things, but healthcare is it's complex. And so understanding what those benefits are and how they apply, we want to make sure that we have dedicated experts at each one of those points. And so if you think about the like the pre-service side of things, if I send an estimate to somebody, I want to ensure that I've provided enough estimate in that or information in that estimate that they can make an informed decision or they understand what's going on. But if they need support or they need to better understand that, making sure that they have a dedicated point of contact that they can engage. Similarly on the inpatient side, so when we have high acuity patients or some of those more complex patients, making sure we have dedicated resources that can speak specifically to their benefits and how they'll perform and how we will apply those things and help make sure that they don't feel overwhelmed or have to have concerns about the financial side of it while their focus should be on their sick child. And then lastly, it's just general customer service. We've got a phenomenal team there that kind of puts a bow on it and they have good perspective into all things that happen. And so if a patient does get a statement in the mail, they have a good resource there that they can talk to about it.
And certainly the estimates are a huge part of this, where patients are able to really then, or the families are able to really understand what those financial liabilities are. But of course, it's challenging to provide an estimate for every, it sounds like for every encounter. That's a great deal of estimates. Are you using any tools that you have found helpful in either streamlining the generation of the estimates or in delivering those to patients?
Yeah, so we leverage a couple of things. Pediatrics is unique in the way in which you deliver estimates from an adult system. I don't want to oversimplify adult medicine, but you are your own guarantor in that instance. And we know you're over 18. And so it lands in the right patient's hands, who is also the one that's financially responsible for it. When we have moms and dads or caregivers that have access to my chart, we want to make sure that we are providing the estimate to the appropriate person. And so my chart has been a huge, we're an Epic shop, so my chart has been a huge benefit to making sure that we're delivering those estimates. And then Epic also recently rolled out something they call Estimates for All. So for our families that don't leverage my chart, as long as we've secured an email address for them, we have a secondary way of making sure that we can get an estimate in front of our families. one of the things that we do is to make sure, because we can't rely on a person to go in there and understand all of the complexities of the care. And so Epic has estimate templates that they allow us to create, where we partner closely with our physicians and our clinical team members to understand that if you're scheduled for a certain encounter, what does that typically entail? And then that's where our templates come in that allow us to send out about 91% of the estimates that we create at Texas Children's are based on one of those templates. There's some highly specialized care that you still need that human touch for, but the rest of them are actually auto-generated to a certain degree. There's more complexity to it than that, but it leverages the templates that we create with our clinical partners. We use real-time eligibility, which is a benefits engine that goes out to the payers and pulls back what the patient's expected out-of-pocket is. And then we marry those two things together and we leverage the estimates for all, and that typically is what gets our estimates in our patients' hands.
Super. That sounds like you're really using all those tools really effectively, and the different aspects or the different options that Epic provides. That's fantastic to hear. Another aspect of the patient financial experience where many hospitals are looking to improve is in the area of collections. And some organizations have noted the value of estimates in kind of helping propel those conversations and improving upfront collection rates. But we've also talked a lot about staff development and training, even setting goals that helps teams to reach those targets. What has your approach been at Texas Children's in terms of improving or maintaining collection rates, and what's worked for your team?
Yeah, you're not wrong. It's definitely a focus. We, as I think every healthcare organization finds that you have more success up front than after the care has been provided. And that's really where we've put this focus on estimates. I think that if we can help families make informed decisions or understand what that cost of care is prior to arrival, and then give them multiple ways to satisfy that balance prior to coming in. And so as we talk about some of our Epic tools that are out there, whether you get that email, whether you get it through my chart, or whether you want to have a conversation with somebody, at every avenue, we provide you an opportunity to pay for that before you arrive for your care. Or at check-in, right, through some of our pre-check-in tools, or once you hit that front desk, making sure, but nobody should be surprised. I think that that's where we get the best support in those conversations for the entirety of our access and our admissions team, is that if Mr. Samp presents and the first time he's heard that he owes $800, he reacts a different way than if he knows that he's going to walk in and have a conversation about an outstanding balance that he's going to be expected to pay. And then making sure that if for whatever reason times are tough, that we provide him with the right payment plans or the right financial assistance options to really help support them on their financial journey. In terms of staff education, it's something that we're constantly trying to refine, making sure that we are just supporting our patients appropriately and making sure that we are sensitive to their financial needs and having the conversations in a compassionate manner.
Well, and it sounds like you've really blended all of the different aspects here. So you're working with the clinicians to make sure that your templates are reflective of the right details for the estimates. You're working with the patients to really communicate, or the patients' families to communicate. And it's really has that personal touch, which really takes us back to the beginning where you talked about how important it is to have that communication and personal approach to working with the patients. Well, we really appreciate you coming on today, and thank you so much.